Hello, my name is Jessica and I'm here with Nicole. Our other group members are Ricky and Brianna, and today we're going to be giving a brief overview on nodules and vocal hemorrhage.
So first, we're going to be talking about the description of nodules and hemorrhage. Vocal nodules are one of the most common lesions to happen within the vocal folds. These take the form of bumps or growths on your vocal folds, and they are benign, meaning they are not cancerous. These nodules can become larger and get more stiff if they are not treated. Vocal hemorrhage occurs when blood leaks into the vocal folds from an injured blood vessel. An injured blood vessel can result from excessive coughing, crying, or screaming, and they often occur unexpectedly.
Now I'm going to be talking about the impact on voice and anatomy for vocal nodules and vocal hemorrhage. So with vocal nodules, they usually occur on both sides of the vocal cords. They tend to vary in size, usually as large as a pea. There are two types of nodules, acute and chronic. Acute nodules result from traumatic or excessive voice use and tend to appear floppy, while chronic nodules have a hardened appearance due to the thickened growth on the vocal cords. For vocal hemorrhages, it usually results in discoloration of the vocal cords. For example, vocal cord discoloration can range from bright red to brownish yellow. Vocal hemorrhages increases the stiffness in the vocal cords, and sometimes scarring can occur. Over here, we have an example of vocal nodules while the vocal folds are separated. And you can see them right here. And here's an example of vocal nodules while the vocal folds are together. You can kind of see that right here.
This is an example of vocal hemorrhage while the vocal folds are together, and you can see it on the left side with the big red spot. And this is another example of a vocal hemorrhage, instead with the vocal folds separated, and you can see it on the right side.
Okay, so now we're going to talk about vocal quality and symptoms. So the anticipated vocal quality is essentially what is your voice going to sound like if you have vocal nodules or vocal fold hemorrhage. So with vocal nodules, your voice might sound rough or scratchy, maybe even harsh, maybe something like this. Your voice might sound breathy, or you might have less control on whether you're able to speak higher or lower. With vocal fold hemorrhage, this doesn't typically impact your speaking voice, but will always impact your singing voice. So if you're a singer, this is most definitely where you're gonna hear those differences. So your voice might sound hoarse. When you speak, you might hear two different tones at the same time. You might have less ability to hold a steady pitch, and your pitch range might become decreased. So you're not able to speak or sing as high or as low as you once have. And this all can range from mild to severe, depending on the person. And so here is an example of somebody who has vocal nodules.
That's it. More E, put an H in front of it now. He.
And you can hear that their voice is breathy. And so right here are the nodules. And so essentially it's preventing her vocal folds from closing all of the way. So there's a lot of air escaping when she speaks, and that's where that breathiness comes from.
Beautiful. And again.
And so now we're going to talk about some symptoms that you might experience. So with vocal nodules, you might experience some increased muscle tension in your throat, neck pain even. You might feel like there's a lump in your throat. So if you've ever been sick and you always feel like something's in your throat and you try to swallow and you can't get rid of it, it's similar to that. Or you might just have your voice and your body is tired. With vocal fold hemorrhage, typically it is painless, but you can experience some discomfort or pain in your throat or your neck. At the time when the bleeding occurs, you might hear your voice change significantly, and you might even lose your voice suddenly. So these are just some symptoms and voice changes to be aware of for vocal nodules and vocal fold hemorrhage.
Now I will talk about prevention and treatment for vocal nodules and hemorrhage. In order to prevent vocal nodules and hemorrhage from occurring, you need to follow vocal health and hygiene strategies. The 4 vocal hygiene strategies are 1, addressing the amount and type of voice use, decreasing voice damaging behaviors, 3, improving hydration, and 4, enhancing lifestyle issues leading to improved vocal health. 1. Amount and type of voice use. Reduce overall voice use. Take vocal naps or rest throughout the day. Allow time to rest between performances. Use a microphone when speaking or performing in front of large audiences or in a large room. 2. Decreasing voice-damaging behaviors. Avoid speaking loudly, yelling, cheering, screaming, or unconventional sounds. Avoid speaking in noisy environments. Do not sing higher or lower than your comfortable pitch and warm up before singing. Do not speak extensively during exercise. Avoid constant or excessive throat clearing and coughing, and avoid holding your breath as you're planning what to say. 3. Hydration. Your vocal cords need to be moist inside and out to work properly, thin any mucus, and reduce risk of injury. You should drink at least 8 to 10 ounces of water per day. You can also inhale steam, use a humidifier, and know that ideal environmental humidity is around 30%. 4. Lifestyle. General overall health has an effect on your voice. So get plenty of sleep, especially the night before a performance. Reduce or avoid consumption of caffeinated beverages. Avoid or reduce smoking, alcohol consumption, and recreational drug use. Certain medications can also cause dehydration, and eat a well-balanced diet. Assessment and treatment. In order to assess if you have vocal fold nodule hemorrhage, you will need to see an ear, nose, and throat doctor or a speech-language pathologist who will use a special device to see your vocal folds and look for any damage. The treatment and prognosis. Surgery and voice therapy, including vocal health strategies, are how vocal nodules are treated. Surgery alone, however, has not been shown to be effective because if a person continues to use vocally abusive behaviors, nodules and hemorrhaging will quickly reoccur. The prognosis or outcome for hemorrhage and nodules is good with treatment. I hope you enjoyed this video and thank you for watching.